The global burden of typhoid is worrying. Dr. John Crump, an international health researcher from New Zealand, told delegates at the ongoing 10th International Conference on Typhoid that cases of typhoid are rising by the day.
The burden of typhoid fever globally is in the range of 15 to 20 million illnesses per year, and we think that about 1% of people with typhoid die, so there are several 100,000 deaths from typhoid worldwide every year.
Typhoid affects sub-Saharan Africa more than any other part of the world. Professor Sam Kariuki of the Kenya Medical Research Institute has been researching about typhoid in sub-Saharan Africa for decades. He says the endemic areas include those with high population density, like slums with low water supply and poor sanitation.
The incidence varies between 150 cases per 100,000 person years to over 500 sometimes in some areas. Quite high compared to the rest of the world.
Typhoid was first reported in Africa over 6 decades ago, and there have been many interventions to curb it. Research shows typhoid prevalence is just increasing.
And there have been even reports from Uganda here. You remember about 2 years ago, there was an outbreak in Kasese, which actually caused several deaths, because that is what we call very severe attack of typhoid, where you have intestinal perforations. So you find that in East Africa, what kind of work we've done is mainly based on very acute outbreaks.
Researchers are now more worried about the growing trend of typhoid resistance to antibiotics. First-line treatment includes ciprofloxacin, chloramphenicol, amoxicillin, ampicillin, and citromoxazole. Research conducted by Uganda's Ministry of Health from 2010 to 2015 indicated rapidly increasing resistance to these drugs.
You find strains earlier on, before the 1990s, could be easily treated with available antibiotics like ampicillin, chloramphenicol, citromoxazole, but now the resistance is as high as 60–70%.
We're approaching a crisis where typhoid will become either very difficult to treat or possibly even impossible to treat.
Experts attribute the problem to antibiotics misuse, which are the cheapest and easily available drugs to the common person.
The use of antibiotics in the community, people taking them when they're not needed or taking them for the wrong reason. There may be taking the wrong antibiotic or taking it for not for long enough to treat the infection.
The good news is that there are new vaccines available, but stakeholders say focus must be placed on prevention more than treatment.
Call it the conjugate VI vaccine. That's one of the most commonly available, and it can protect up to 3 years when given as a vaccination program.
Most often used actually among travellers from wealthy countries to low resource areas. And they're limited by the fact that they don't protect below 2 years of age, and we know there's a lot of disease in infants and young children.
Uganda has suffered typhoid outbreaks in recent years. In June 2015, the Health Ministry recorded over 10,000 cases, 15 of them in Kampala and the neighboring areas, 249 in Kasese, and these were severe with intestinal perforations. Typhoid is spread by a bacteria called Salmonella typhi. It is spread through contact with contaminated food or water and occasionally through direct contact with an infected person. Most cases in Africa result from the consumption of contaminated water and poor sanitation. Gertrude Tumusime with Kwade, NTV.